Hello everyone and welcome back. My name is Dr. Ben Osevwe, and today we are going to talk about Kratom in a simple, clear and clinically practical way. This lesson is for PMHNP students, psychiatric providers and healthcare professionals who may see patients using Kratom for pain, anxiety, depression, energy, focus or opioid withdrawal. By the end of this video, you should be able to explain Kratom in an easy way, while still understanding the clinical concerns. We will talk about what Kratom is, how it works in the brain and body, and why patients use it. We'll cover complications, signs of dependence, treatment options, and non-judgmental screening. Short disclaimer: this video is for education only. It is not medical advice, diagnosis, or treatment. Kratom can cause serious health complications. If overdose is suspected, call emergency services immediately. Kratom is a plant-based substance from the leaves of the Mitragina speciosa tree. This tree is native to Southeast Asia, where it has been used traditionally for many years. Kratom can act like a stimulant at lower doses, helping people feel more awake and focused. At higher doses, it acts more like an opioid, used to reduce pain, relax, or manage withdrawal. Kratom may be sold as powder, capsules, or tea. It's often found in gas stations and smoke shops. It also comes in concentrated forms like extracts, shots, gummies, tablets, and enriched products. Just because Kratom is legal or plant-based does not mean it is automatically safe. Many natural substances can still affect the brain, liver, heart, kidneys, breathing, and medication safety. Part 2: Why Kratom matters clinically. Many patients use it but may not tell their providers. Some patients avoid mentioning it because they fear judgment or being labeled as drug-seeking. That is why providers need to ask directly. Instead of just asking about medications, ask about supplements. Ask: many people use natural products for pain or anxiety. Are you using anything like Kratom? The goal is not to shame the patient. The goal is safety and understanding the patient's full story. Part 3: What are the main active ingredients? Kratom contains active plant chemicals called alkaloids. Two important alkaloids are mitragynine and 7-OH. 7-OH is much more potent, even in small amounts. Commercial products may be enriched with 7-OH, making them much stronger than traditional tea. Part 4: How does Kratom work in the brain? It interacts with mu-opioid receptors. This can produce opioid-like effects including pain relief, relaxation, sedation, and euphoria. It can also cause side effects like constipation, itching, and the development of dependence. At lower doses, it acts on stimulant pathways, helping with fatigue and motivation. Kratom also affects serotonin, norepinephrine, and dopamine, which help regulate mood and alertness. Part 5: Why do people use Kratom? Patients are often trying to solve a real problem. Common reasons include chronic pain, anxiety, depression, and trying to reduce opioid use. People also use it for energy, focus, and stress. It is legal and often easy to buy. Instead of asking why would you take that, ask what were you hoping it would help with. Part 6: Why clinicians often miss it. Patients may think of it as a wellness product or tea. Medication reconciliation should include anything the patient buys outside the pharmacy. Part 7: Kratom dependence. This can develop when the body and brain get used to the substance. A patient may say, "I only take it to feel normal now," or "I cannot start my day without it." Signs include cravings, failed attempts to cut down, and functional problems at work or home. Part 8: Kratom withdrawal. Symptoms may look like a mix of opioid and stimulant withdrawal. Common symptoms include anxiety, irritability, muscle aches, sweating, and nausea. It can also cause significant restlessness, insomnia, low mood, and intense cravings. Ask: how much are you using, how often, and what happens if you miss a dose? Part 9: Possible health risks and complications. These can be very serious. Kratom has been linked to liver injury, kidney problems, heart issues, and seizures. Other risks include confusion, severe sedation, respiratory complications, and cognitive changes. The biggest danger is often Kratom plus other substances like alcohol, benzodiazepines, or opioids. Part 10: Pregnancy. Maternal Kratom use can expose the fetus and lead to neonatal withdrawal. Newborns may experience irritability, tremors, and poor feeding, requiring close clinical monitoring. Part 11. Clinical screening. Use a calm and normal tone to ask about gas station or herbal products. Follow up with questions about how much they use, why they started, and if they've had any ER visits. Part 12. Treatment and management. The good news is that patients can get help. Explain risks clearly. Kratom may feel helpful at first, but it can cause dependence and health problems. A gradual medical taper can help reduce withdrawal symptoms compared to stopping suddenly. Supportive care includes hydration, sleep support, and managing nausea or anxiety. Treat the reasons they use it, such as chronic pain, anxiety, depression, or trauma. Therapy like CBT and motivational interviewing can be essential for long-term recovery. In some cases, specialty addiction treatment and buprenorphine-based therapy may be considered. Ask about other substances like alcohol or fentanyl, as co-use increases psychiatric risk. Provide naloxone education if there's any risk of opioid co-ingestion or overdose. Part 13. Nutrition. While vitamins don't cure dependence, they support overall recovery. Focus on regular meals with protein, vegetables, fiber, and adequate hydration. Nutrients like vitamin D and B vitamins support general health, brain function, and mood. Magnesium and omega-3 fatty acids support muscle, nerve, brain, and heart health. Be very cautious with unregulated detox products or other herbal supplements like kava. Explain. My goal is to keep you safe and help treat the reason you started using it. Part 15. When is it an emergency? Seek help for trouble breathing or seizures. Emergency help is needed for chest pain, severe confusion, or any suicidal thoughts. Part 16. Advocacy. We need clear labeling, age restrictions, and better clinical education. Kratom is real, and complications can happen. With respectful screening, we can help patients recover. My name is Dr. Ben Osevwe. Join our mentorship family today at rotationmatchnetwork.com. Thank you for watching. And remember, listen without judgment and help patients choose safer paths. We look forward to seeing you in the next lesson. Take care.